Welcome. When most people think about chiropractic, they think about it as a great way to treat back pain. And while chiropractic is a fantastic way to naturally recover from back pain, dozens of studies over the last few years have found that chiropractic adjustments can help with many other health conditions. Medical research has shown that chiropractic can reduce blood pressure, help you recover from car accidents, boost your immune system, help with sciatica pain, prevent migraine headaches, reduce hip pain caused by osteoarthritis, reduce fibromyalgia pain, reduce the risk of sports injuries, decrease pain from TMJ disorders, and reduce inflammation in your body. As you can see, chiropractic is more than just back pain treatment. Chiropractic is for your whole body. To learn more about chiropractic and how the doctor can help you, feel free to explore our library of videos. Each week we'll be adding a new video, so make sure to sign up for our video updates. If you have any questions, you can email the doctor or give our office a call at the number above.
What is chiropractic? Chiropractic is a safe, natural, and effective way to improve your health and relieve pain by restoring the function of your body's nervous system. Your nervous system controls every system of your body. The central nervous system is made up of the brain and spinal cord. Spinal nerves branch out from the spinal cord and travel to nearly every cell in the body, transmitting nerve impulses to and from the brain. The spinal nerves are the only source of communication between the body and the brain, so your health is dependent on them working without interference. If your back or neck is stressed or injured, it causes restricted movement and reduced flexibility. This is called subluxation. If left untreated, the joints of your spine can become inflamed and swollen, and the damaged tissues release inflammatory chemicals that can disrupt the spinal nerve function. Sometimes it can even result in compression of the spinal nerve through swelling or with a disc herniation. A subluxation may start out as pain-free, but if left untreated, you may begin to experience symptoms. Sometimes a subluxation will manifest itself as pain, like sciatica or back pain, but since the spinal nerves communicate with all of the major organs of the body, your symptoms may manifest as other health problems. Your chiropractor identifies the subluxations and gently adjusts the vertebrae. This chiropractic adjustment restores the natural movement and function of the spine and reduces the interference on the nerve. This can relieve pain and dramatically improve your overall health. In fact, research shows that chiropractic directly affects the nervous system and can reduce blood pressure, heart rate, and stress hormones, release endorphins, and boost the immune system, all by removing the spinal subluxation and allowing your nervous system to function properly. By eliminating interference to your nervous system, your body's innate ability to heal is restored. A healthy spine means a healthy nervous system. So if you want to boost your health or relieve pain, chiropractic is the answer. Call our office today to see how we can help you achieve a healthy and pain-free life.
New research helps to explain why chiropractic is so effective for low back pain. Using MRI scans, researchers were able to document the immediate benefits of chiropractic adjustments. Patients with low back pain have restricted mobility in the lumbar spine that results in degenerative changes and fibrous adhesions within the joints of the vertebrae. Researchers hypothesized that chiropractic adjustments increase gapping between the joints of the vertebrae, which breaks up adhesions and allows the joints to move freely. In a new study, 112 patients with low back pain were randomly assigned to receive either chiropractic adjustments, side posture positioning, or 2 controlled treatments. Immediately after the treatment, they received an MRI scan that allowed researchers to analyze spinal gapping. Patients treated with a combination of chiropractic adjustments and side posture positioning had the greatest reductions in pain. This study shows how chiropractic can restore spinal health to decrease disability and pain. Call our office for effective back pain relief today.
Chiropractic is about more than just back pain relief. It's the natural approach to whole body wellness. Medical studies show that chiropractic is effective for headaches, migraines, dizziness, and neck pain. Patients with auto injuries, tinnitus, jaw disorders, fibromyalgia, and shoulder pain have also found relief with chiropractic. It can also be beneficial for conditions associated with aging, like scoliosis, spinal degeneration, and osteoarthritis in the knee, hip, and hands. By easing pressure on irritated nerves, chiropractic adjustments can alleviate nerve impingement, radicular pain, carpal tunnel syndrome, and sciatica. Chiropractic care can also help with pregnancy-related pain and discomfort, in addition to correcting dysfunctions in the sacroiliac joint and pelvis. And while chiropractic can relieve a number of pain conditions, it can also improve your overall health. Research shows that spinal adjustments can reduce blood pressure, soothe stress hormones, and boost immunity. Call our office today to learn how chiropractic can help the whole you.
Let's face it, cost is an important factor when we're considering our healthcare options. We want quality care that works without racking up unnecessary medical bills. A growing body of research shows that chiropractic is both effective and less expensive than more invasive medical treatments. In a recent study, researchers analyzed the medical spending of over 12,000 adults with spine conditions. They discovered that people who use alternative therapies have lower annual healthcare costs compared to patients receiving traditional treatments. Chiropractic care contributed significantly to reduced costs since chiropractic accounted for 75% of alternative therapy use. Earlier research has found that chiropractic prevented recurring disability in patients with back pain, which could help to minimize medical spending. Studies have also suggested that chiropractic cuts costs for patients by helping them avoid unnecessary procedures, tests, surgeries, and expensive drugs. Instead, chiropractors work to harness the body's innate healing capabilities with a combination of natural, effective modalities. Call our office today to learn more.
Researchers are finding new benefits of chiropractic care every year. Study after study has shown how successful chiropractic can be for treating pain, but a new study shows it may also help boost your immune system. In a first-of-its-kind study, researchers from the Canadian Memorial Chiropractic College investigated how chiropractic adjustments can boost antibodies that help keep people healthy. The study examined 74 patients. None of them had any pain or had ever been to a chiropractor. Researchers took a blood sample before and after receiving adjustments and found some intriguing results. The blood samples taken after treatments showed an increase in antibodies known to fight off infection. Researchers believe this shows that chiropractic care can jumpstart the immune system, resulting in better protection against infections. While more studies need to be done, researchers say chiropractic care isn't just for pain. It can also help you improve your overall health.
More and more children are receiving chiropractic care, and there's a good reason why. Chiropractic provides safe, natural treatment for a number of conditions while promoting wellness. Multiple studies point to the safety of chiropractic for kids. In a 2012 survey of European chiropractors, fewer than 1% of children experienced side effects from chiropractic treatments, and those side effects were all mild. This confirms the results of 3 other studies in which no serious side effects were reported in pediatric patients receiving chiropractic treatment. Research suggests that chiropractic can safely relieve musculoskeletal pain in children. In a 2003 study, 62% of pediatric patients had substantial reductions in back pain after receiving chiropractic adjustments. Treatments of musculoskeletal conditions continues to be the #1 reason why children receive chiropractic care. But chiropractic does more than treat conditions. It can help children improve their health through wellness care. In a 2009 survey, one of the primary reasons why parents took their children to see a chiropractor was for wellness care. Current research shows that chiropractic can reduce blood pressure, heart rate, stress hormones, release endorphins, and boost the immune system. Whether you're hoping to ease your child's pain or improve their health, chiropractic can help. Contact our office to learn more.
As we age, we all start to develop aches and pains that affect our quality of life. Wouldn't it be great if there was a way to stay active and healthy as we get older? Well, there is. Chiropractic is an effective way to maintain the health of your spine and prevent spinal degeneration. Let's see how chiropractic can help. Your spine is very strong and flexible. It contains bones called vertebrae, and each of these bones is separated by tough, fibrous discs. The discs cushion the vertebrae and allow the bones of your spine to move smoothly and without pain. The spine is held together with tough bands called ligaments, and hundreds of muscles are attached to it that help us maintain posture and allow us to move. As we age and experience decades of injuries and wear and tear on our spines, the discs, ligaments, and muscles that support us begin to develop scar tissue, lose their flexibility, and become rigid. The flexible discs begin to dry out and shrink, causing the joints to not be able to move as smoothly as they did when we were young. If we have untreated injuries or decades of bad posture, some of these joints may become completely immobile and fixated. The ligaments that hold the joints together can actually begin to calcify, causing the bones of your spine to fuse. These inflexible areas of your spine reduce your body's mobility and result in chronic pain. The areas of the spine above and below the fixated joints compensate for the stiff areas and are exposed to excessive motion. This can cause them to become inflamed and painful too. This can put pressure or pinch the nerves that travel from your spinal cord to other parts of your body. Chiropractic can help keep your spine flexible as you age and help prevent spinal degeneration. Your chiropractor finds those areas of the spine that are beginning to become fixated or immobile and adjusts them. This spinal adjustment works by stretching the joint capsule and breaking up scar tissue. Adjustments also activate special nerves in the spinal joints that break up pain signals in the spinal cord and help the muscles in the area relax. By keeping your spine healthy and flexible throughout your life, you can prevent pain and disability later in life caused by spinal degeneration. So, if you're starting to feel aches and pains in your back, or you've experienced an injury, do something about it today so you'll have a healthy back later in life. Call our office today and see how we can help.
Chiropractic is a natural, non-invasive therapy that has been helping people improve their health for over 110 years. Scientific studies have shown that chiropractic can be an effective treatment for a variety of health issues, including back pain, sciatica, neck pain, dizziness, and even high blood pressure. Millions of people have benefited from the natural approach of chiropractic. And in this presentation, we'll look at how your back can be injured and how chiropractic can help restore your body to healthy functioning. The human spine is an amazingly versatile and complex structure that provides support to the body, protects the internal organs and nervous system, and allows incredible flexibility and movement. The spine can also be exposed to very high forces, especially during lifting, where certain parts of the spine can experience over 300 pounds of force. This combination of flexibility and complexity makes the spine vulnerable to injury. And in fact, over 1/3 of adults report some kind of frequent back pain. Let's look at the parts that make up the spine so we can better understand how injury can occur and how chiropractic can help. The building blocks of the spine are the bony vertebrae. The vertebrae are very strong and they support the weight of the body and protect the spinal cord, blood vessels, and nerves of the torso. The vertebral discs are made of fibrous tissue and act as shock absorbers between the individual vertebrae, protecting the bones from damage and allowing the bones to bend and rotate. The spinal cord passes through each of the vertebrae, and the spinal nerves branch out between each vertebral segment. These spinal nerves travel throughout the body, innervating our muscles and internal organs, allowing us to sense our surroundings and move our bodies. The bones of the vertebrae are held together by ligaments, which are tough bands that act as straps. Excessive movement would be dangerous to the spinal cord and spinal nerves, and the ligaments limit this motion. Movement and stability of the spine is made possible by hundreds of muscles that attach to the vertebrae. The small muscles that attach to the spine work without our conscious control and are constantly stabilizing the spine and maintaining our upright posture. Many different pieces have to work together to maintain a healthy spine. When all of these pieces are working together in harmony, we're not even aware of them. When one piece fails to work properly, all of the other parts are affected as well. The role of chiropractic is to make sure that all of the pieces work together the way they're supposed to. Injury to the spine can involve many different structures. we're going to look at ligament injury, which is very common in back pain and can be caused by improper lifting. When a ligament is injured, a number of things happen. The body's first reaction is to prevent further injury. It's a simple reflex where the injured ligaments send a signal to the spinal cord, which in turn sends a signal to the muscles of the surrounding area to contract or tighten. The contracting muscles protect the spine from further injury by limiting motion. This is why after a back injury, you feel that the surrounding muscles are tense and sore. Next, the injured tissues become inflamed when the body sends white blood cells and chemicals to the area to start the healing process. Inflammation causes pain and further restricted movement of the joint. Finally, the body has to repair the damaged ligament, and it does that by creating scar tissue, which is like a quick patch to the injured tissues. The problem with scar tissue, though, is that it is not nearly as flexible as normal, healthy tissue. This results in the joint losing much of its mobility, further restricting motion. The result of all this guarding, inflammation, and scar tissue is reduced mobility and range of motion. This impaired flexibility puts a tremendous strain on the joints of the spine, resulting in increased wear and tear on the discs between the vertebrae. This immobility in the injured area also affects how your entire body functions. Pain and restriction here can alter how the rest of your body moves. Left untreated, this pattern between the muscles, the spinal cord, and the brain can result in permanent dysfunction of the injured area and result in pain in other parts of the body as well. As we've seen, a flexible spine is a healthy spine, and that's what chiropractic does. It helps your spine regain its mobility. To do that, your chiropractor finds those joints that are not moving well. Then those vertebrae are adjusted or rapidly moved. This stretches the joint, stimulating the nerves in the joint that detect motion. While chiropractic focuses on individual vertebrae, the effects of the treatment are much more widespread. Recent medical research shows that chiropractic has dramatic effects on the central nervous system. Chiropractic helps your spine regain its healthy functioning in 3 ways. First, chiropractic works by creating movement in the ligaments of the spine. Research suggests that when the ligaments are stretched during a chiropractic adjustment, the scar tissue is broken down, allowing the ligament to grow new, healthy tissue. Second, the adjusted vertebrae sends nerve signals to the spinal cord and to the brainstem. Immediately, the pain signals are interrupted in the spinal cord, breaking the pattern of tension that causes fixation of the joint. And third, research has found that chiropractic also has direct effects on the brain itself. According to recent studies from both the US and New Zealand, chiropractic adjustments send nerve impulses to the lower portions of the brain. These impulses affect how the brain processes pain and seem to reduce the sensitization or overstimulation that occurs in chronic pain. So chiropractic really works on at least 3 different levels. It works by mobilizing the ligaments of the spine, which can help the ligaments heal. It creates nerve impulses that break up the pain patterns in the back, and it stimulates brain functions that help reduce pain patterns. If you have pain or limited function from an injury, chiropractic might be able to help. The first step is to perform a thorough exam and history of your symptoms. Once we've done that, we can put together a
Do you suffer from pain or numbness in your low back, hip, or leg? If you do, you might have sciatica. Sciatica can be very painful and even disabling. The good news is that chiropractic can be an effective treatment for this common problem. What is sciatica? Sciatica is caused by pressure or irritation of the sciatic nerve. The sciatic nerve is the largest nerve in the body, and it travels from your spinal cord to your leg, passing through the buttocks and hip. Because the sciatic nerve is so large, and because it passes through so many parts of the body, it's vulnerable to getting pinched or irritated. What are the symptoms of sciatica? Sciatica can be experienced as a burning or shooting pain, numbness, aching, or a tingling sensation that can be felt in the lower back, the buttocks, the hip, or the leg and foot. It's usually only experienced on one side of the body. This pain can make it very difficult to sit, stand, or walk. Chronic sciatic pain can result in poor posture or pain in the other parts of the body, as you might alter your gait or compensate for the pain in your hip or leg. What causes sciatica? Sciatic pain is not an actual diagnosis itself, but a symptom of a larger problem. In most cases, sciatic nerve pain is the result of some mechanical misalignment of the body. This misalignment puts pressure on the nerve, which creates inflammation and pain. The sciatic nerve can be pinched or irritated in the lower back by the muscles in the buttocks, the hip, or it might be caused by direct trauma to the nerve. In some cases, sciatica can be the result of a more serious health problem, so it's very important to have it checked out. How can chiropractic help? Chiropractic can be an effective treatment for sciatica because we get to the root of the problem rather than just treating the symptoms. In the case of sciatica, we'll first do a careful examination to determine the actual cause of the nerve pressure or irritation. Next, we'll work to correct the problem using a variety of proven therapeutic techniques. Once we start to correct your body's mechanics and remove the compression on the nerve, the irritation will be reduced and the nerve will begin to heal. Recovery time is different for each patient and depends on your level of health and fitness and how long you've been in pain. Chronic sciatica can take some time to treat because of the scar tissue in the region and the chemical effects of the chronic nerve irritation. You don't have to suffer from sciatica. Give our office a call and schedule a consultation today to see if we can help you.
If you suffer from sciatica, you may be considering surgery to relieve the pain. Before you do, you should consider the risk of surgery. Typically, patients who have surgery undergo the conventional approach known as microdiscectomy. A newer form of surgery known as tubular discectomy is claimed to be safer. But how effective is this new method? A recent study published by the AMA reports that this new method may not be better at all. In this study, 328 patients with sciatica due to lumbar disc herniation were randomly assigned to have either the conventional or the less invasive surgery method. The study found that both groups experienced the same rates of complications, and the less invasive approach did not reduce the average recovery time or length of hospital stays. Furthermore, the patients who received the less invasive surgery actually reported a higher degree of disability than conventional surgery patients. With either surgical method, 1 out of 10 patients had some kind of complication. Numerous studies have proven that chiropractic is an effective, non-invasive treatment for many patients with sciatica. A study from 2010 included 40 patients with sciatica who had tried other treatments but were still experiencing pain. Half of the participants in the study were randomly assigned to surgery, and the other half of participants were treated with chiropractic adjustments. 60% of patients who had chiropractic adjustments experienced improvement of their pain and daily functioning. Furthermore, those patients did not experience the complication that can occur with surgery. The strong success rate of chiropractic adjustment in treating sciatica led researchers to recommend that patients seek chiropractic care before opting for surgery. If you or a loved one suffers from sciatica, you can avoid the risk and the expense of surgery by seeking conservative care prior to resorting to surgery. Talk to a chiropractor about safe, non-invasive treatment to relieve your sciatica pain.
Our lives seem to be getting busier and more stressful all the time. Work weeks are getting longer, commutes more frustrating, and family obligations take up most of our free time. All of these stresses accumulate and take a toll on our physical and mental health. When we combine stress with the fact that many of us have jobs that require sitting at a desk all day, it's not surprising that some of us have trouble with muscle tension and pain. This tension and stress can build up over time, causing symptoms like headaches, neck, back, and shoulder pain, or carpal tunnel syndrome. Preventing tension now is much easier than treating a chronic health problem later. The good news is that there are some simple things that you can do to reduce tension and pain at work and improve your productivity and overall health at the same time. There are 3 steps to improving your workplace health. They are maintaining proper ergonomics, staying mobile, and muscle-relaxing stretches. The key to reducing workplace stress is to make sure that your body is always working efficiently. Wasted movements or awkward positions are likely to cause problems down the road. The healthiest position for your body is one where you maintain good posture. By keeping your body in its natural position, you put less strain on your back and neck, and you reduce the chance of stress and strain. Why is posture important? Because your nervous system depends on it for proper functioning. The spine supports your body and protects the spinal cord. Nerves branch out from each segment of your spine, and these nerves travel to different parts of your body. If these nerves become pinched or compressed because of bad posture or muscle tension, they may become irritated. Pressure on the nerves can cause headache, arm pain, carpal tunnel syndrome, back pain, and sciatica. Good posture can reduce the strain on these nerves and prevent these painful conditions. To maintain healthy posture, you need to make sure your work area is arranged correctly. Adjust your monitor so it sits just a bit below eye level. This allows you to hold your head in a relaxed position. Straightening your neck looking up, down, or to the side is a sure way to create neck tension and pain. Adjust your chair so that your feet are solidly on the floor. This can prevent back problems. A chair with lumbar support can also relieve strain on your back. Keep your keyboard at the proper level. To do this, have it set so that your elbows are at a comfortable 90-degree angle. If your keyboard and mouse are too high, you'll put extra stress on your neck and shoulders. Also, make sure that your hands and wrists are in a natural position as much as possible. Bending your wrists puts unnecessary strain on your arms and hands. Ergonomic keyboards are available that help you keep your hands in a relaxed position. Using your head to hold the telephone is a common cause of neck pain. If you use the phone often during the day, you should consider a headset. A headset allows you to hold your head upright. Keeping the telephone close at hand could also reduce stress and strain caused by reaching. Proper posture and ergonomics are just the first step. It's also important to keep your body mobile. This can be as simple as getting up from your desk to use the printer, or taking a brisk walk in the middle of the day. Make the most of your break times. Don't eat lunch at your desk. Take advantage of your lunch hour and coffee breaks to get away from your desk and move your body. A 15-minute walk is a great way to relieve stress and improve your health. The third step in reducing workplace tension is stretching. Simple stretches that you can perform right at your desk can dramatically reduce muscle fatigue and pain, but you must follow a few rules. First, if you already have pain, check with your healthcare provider before you perform any stretches. Stretching injured tissues may cause more pain. Second, stretch within your comfort level. If you experience pain during any of these stretches, don't do that stretch. Third, do each of the stretches slowly and steadily. Don't bounce when doing a stretch, but exert even, gentle pressure. Now let's look at some of the common symptoms of workplace tension and see how simple stretches can help prevent them. Headaches are a common symptom experienced by computer users. Headaches can be caused by eye strain from improper lighting or glare on computer monitors or poor ergonomics. Muscle tension is a common cause of headaches and neck pain. Tension in the neck can appear as headache in other parts of the head. The spinal nerves can also become irritated, causing headaches. So, to prevent headaches, it's important to keep your neck in its natural position as much as possible. Here are some stretches that are good at keeping your neck relaxed. Neck rotations are a good way to stretch your neck muscles. First, sit or stand up straight. Turn your head from side to side without moving your shoulders or upper back. Hold each side for 3 to 5 seconds. Repeat 3 to 5 times for each side. Side stretches help stretch the muscles along the side of your neck. Do one side first and then the other. Repeat 3 to 5 times for each side. Shoulder rolls can help loosen up your lower neck. Move both of your shoulders in a circle. Do 5 to 10 rotations. Chin tucks are great for stretching the upper neck. Sit up tall and look straight ahead. Slowly tuck your chin in towards you. Hold for 5 to 10 seconds and then relax. Do these 3 to 5 times. Shoulder shrugs can help you relax your neck. Lift your shoulders up to your ears, hold for at least 10 seconds, and then slowly relax. Repeat 5 to 10 times. For another shoulder stretch, clasp your hands together and reach palms up toward the ceiling. Hold for at least 10 seconds and repeat 5 to 10 times. The eyes can become tired from looking at a computer monitor for hours at a time, and it's important to stretch them as well. A great way to do this is to roll your eyes in circles, first clockwise for 10 rotations, and then counterclockwise for 10 rotations. Back pain is another common problem. A chair with improper support, sitting with poor posture, or having a seat that is improperly positioned can cause back pain. Make sure that your seat is adjusted so that you don't have to bend over to use your computer. Here are some stretches good for your back. Toned abdominals are a good way to prevent back pain. Sit with your hips against the back of your chair and tighten your abdominal muscles by pulling them in. Keep your chest relaxed and continue to breathe normally while you hold the abdominals tight for 10 seconds. Repeat 5 to 10 times. Hamstring stretches can reduce stress in your lower back. Sit with your hips against the back of the chair. Now, straighten your knee until you feel the stretch in the back of your leg. To increase the stretch, lift your toes toward you. Hold for 20 to 30 seconds. Repeat 1 to 2 times for each leg. Low back bends are another stretch that you can perform. Stand with your feet apart and place your hands on your lower back. Gently bend backwards. Hold for 3 to 5 seconds, repeating 1 to 3 times. Next is the side stretch. Drop your left shoulder, reaching your left hand toward the floor. Hold for at least 10 seconds. Return to starting position and then repeat on the right side. Finally, one of the most common problems experienced by office workers is arm, wrist, and hand pain. The muscles in your body are capable of moving your body in many ways, but they can become tense when performing the same task repeatedly or when they aren't stretched and moved. Keeping your hands in one position for long periods of time or performing the same action over and over can overuse the muscles of your arms. This leads to strain of the muscles, swelling of the tissues, and pain. Understanding hand pain is easy when we look at our hand, wrist, arm, shoulder, and neck as one unit. The blood vessels and nerves that supply your hands travel from your neck and shoulder. Tension or inflammation in the neck, shoulder, or arm can cause problems in your hand. Because the arm is so versatile and can move in so many different directions, the nerves and blood vessels that travel through the arm are susceptible to injury and strain. The nerves and blood vessels of the arm can be pinched in the spine itself, the shoulder, the elbow, or the wrist. Compression can be caused by 3 different structures: bones, muscles, or ligaments. The bones of the spine can become misaligned, causing compression of the nerve. The muscles of the neck can become tense, pinching the nerves or blood vessels. And the ligaments of the wrist can pinch the nerve of the hand, causing carpal tunnel syndrome. Stretches can be a great way to reduce problems in the arm. Here are some exercises that will help keep your neck, shoulders, and arms tension-free. The shoulder blade pinch is good for releasing shoulder tension. With your arms by your side, bend your elbows to 90 degrees. Squeeze your shoulder blades together downward and backward. Keep your head and back straight and relaxed. Hold this stretch for 5 to 10 seconds, repeating 5 to 10 times. A common source of arm pain is tension in the upper shoulder and lower neck. The pectoral stretch helps relax the muscles in the shoulder that can pinch nerves and blood vessels that supply the arm. Place one forearm against a wall or door with your elbow level with your shoulder. Turn your body away from your arm. You'll feel a stretch in the front of your shoulder and in the chest. Hold for 20 to 30 seconds. Repeat 1 to 2 times on each side. Using a keyboard all day can cause tension in your forearms. There are 2 wrist stretches that can help. For the first one, hold your arm straight in front of you, palm down, and bend your wrist down. With your other hand, gently pull the hand down until you feel a stretch in the top of the wrist and forearm. To increase the stretch, make a relaxed fist. Hold for 5 to 10 seconds, repeating 2 to 3 times for each arm. For the second wrist stretch, hold your arm straight out in front of you, this time with your palm up. Bend your wrist with fingers pointing down. With your other hand, gently pull the fingers back to increase the stretch. Hold for 5 to 10 seconds and repeat 2 to 3 times. Stretching is a great way to keep your muscles active while sitting at your desk. When the muscles are stretched, it increases the flow of nutrients and oxygen to them, preventing strain and cramping. Stretches can be done right at your desk, and they only take a few minutes. Try to stretch as often as you can, at least every few hours. Remember, you shouldn't feel pain when stretching. If you do experience pain, consult your healthcare provider. Proper ergonomics, good posture, and stretching are all things that you can do to help prevent workplace tension and pain. Another great way to prevent or treat workplace tension is massage therapy. As we saw earlier, poor posture and tension can impinge on the nerves and blood vessels that pass through the neck, shoulder, and arm. Therapeutic massage is an effective way to reduce muscular tension, allowing the body to work efficiently and pain-free. Many people with workplace tension use medications to relieve pain. While drugs can reduce symptoms temporarily, they do nothing for the underlying cause of the pain. After the drugs wear off, the symptoms usually come right back and over time get worse. While stretches are a great way to reduce tension, a massage therapist is specifically trained to locate those areas of the body with tension and help your body stay healthy. While stretches are a great way to reduce tension, a massage therapist is specifically trained to locate those areas of the body with tension and help your body stay healthy. Massage therapy doesn't cover up the symptoms, but works by removing the root cause of the problem, the muscular tension. If you have pain, Or if you would like to prevent symptoms in the future, ask your massage therapist how massage can help.
Hi, this is Marissa with Chiropractic News for November 2011. Do you take vitamins? If so, you're in the company of more than half of Americans who report taking a multivitamin or other dietary supplement. These tiny little capsules have garnered a lot of attention in the news lately. That's because several recent studies have come out identifying new information and new questions about vitamins. All these studies can be a little confusing though. Some recent headlines include, vitamin E doesn't prevent cancer but may slightly increase your risk of prostate cancer. Vitamin D can help fight tuberculosis, and calcium may not improve outcomes for pregnant women. If your head's spinning, you're not alone. A lot of people are wondering which vitamins they should start, stop, or continue taking. The varying results from these studies remind us of the complexity of nutrition and vitamins. While many supplements can be beneficial to your health, other supplements still need further research to understand their full impact. There are some guidelines, though, that can help you determine which supplements you should include in your diet. First, not all supplements are created equally. Low-grade supplements are often not as soluble, which means the body has difficulty accessing the nutrients. If you're going through the trouble of taking vitamins, you want to make sure they're high quality so your body can experience the full benefits. Many chiropractors have supplements on hand in their office or can recommend you to good sources. Second, there seems to be a consensus among doctors that the best way to receive vitamins is through eating healthy food. A lot of people have grown accustomed to eating primarily processed foods, which often lack the nutritional benefit of unprocessed food. And taking vitamins isn't a simple answer to that lack of nutrition either. Nutrients inside of food interact in complex ways that can't always be replicated in supplements. Taking supplements can be a good way to enhance your healthy diet or fill in if you have a vitamin deficiency, but they aren't meant to replace your healthy diet. Ask your doctor for more information about healthy nutrition and vitamin deficiency. Finally, every person will have a unique set of vitamin needs. What supplements you should take depends on several factors like your diet, age, sex, and whether you have a deficiency. Your chiropractor has received nutritional training and can counsel you on which supplements are right for you. Your chiropractor does more than just treat pain. They're there to help you lead a happier, healthier life. Hi, this is Marissa for Chiro Nexus News. In today's tech-heavy world, there are a number of activities putting significant stress on our wrists and arms. Texting, typing, and surfing the web have taken a toll on our bodies, as an increasing number of people suffer from carpal tunnel syndrome. Fortunately, new research confirms the efficacy of chiropractic treatment for carpal tunnel syndrome. In a published case study, a 47-year-old woman worked at a computer all day entering data. When she noticed significant weakness, pain, and disability in her wrist, she visited her doctor. She had developed carpal tunnel syndrome and cysts in her wrist. For 2 years, she tried numerous treatment methods, including wearing a splint and surgery, but nothing seemed to work. The authors of the study created a new treatment plan that included chiropractic adjustments, soft tissue therapies, and exercises. After 3 months, the patient's pain had dropped significantly, and the tingling and numbness had disappeared completely. She also had major improvements in wrist strength and range of motion. Although the woman was permanently impaired, a multifaceted chiropractic treatment alleviated many of her symptoms. This led researchers to conclude that her treatment was successful. Chiropractic adjustments can help carpal tunnel syndrome by relieving the compression of nerves in the neck and arm that can cause you pain. Your chiropractor can also work to relax muscles and reduce inflammation, and can prescribe exercises and stretches that can strengthen the muscles, decrease disability, and promote healing. Don't let carpal tunnel syndrome interfere with your life. Contact our office today to see how we can help. Hi, this is Marissa for Chiro Nexus News, November 2011. When people think of injuries suffered by our troops, they imagine veterans with more visible injuries and disabilities. But there's a less visible trauma that often is overlooked: chronic back pain. Research has found that the number of veterans with low back pain is rising. This chronic back pain can be a huge barrier for veterans returning to civilian life. Fortunately, new research has found that chiropractic can help our veterans. A recent study tracked the progress of 171 veterans receiving chiropractic care. The patients had been suffering from back pain for more than 6 months on average. Chiropractors in the study used various techniques to treat the patients, and they also provided exercises and stretches tailored to the patient's specific needs. After just 2 chiropractic treatments, 60% of veterans improved significantly. The majority of patients experienced reduced pain, better daily functioning, decreased disability, and reduced levels of anxiety and depression. Researchers noted that these changes were clinically significant. With the growing occurrence of back pain among veterans, chiropractors have stepped up to successfully treat injured service members. Last year, the Congress of Chiropractic State Associations joined forces with Army OneSource to launch a national campaign called Healing Hands for Heroes. The campaign seeks to educate chiropractors about the specific needs of serving veterans and to help vets better connect with doctors. Chiropractic care can be a crucial component in helping vets recover from war and restore the healthy life they deserve.